Guys, today I want to give some informations about closed rhinoplasty surgery. Closed rhinoplasty, as you know, is a technique and without any skin incision in this area. We call about here is columellar region, and there will not be any scar tissue, and inside of both nostrils two differently incisions. We can complete all this surgery with this techniques. In here you can see some illustrations about closed rhinoplasty techniques. Depends on problems, we can do different area inside of nostrils, these incisions also too, and we can reach every part of all around to nose also too. Somebody else call about this surgery endonasal surgery, and here is different incisions for this surgery. This is also open technique at columellar region incisions. We can open nose tip and we can reach inside of nose also too. This is also after alar wings incisions. We reach the alar wings and we can complete the surgery with invisible these incisions also too. You can see here is a open technique incision lines, lower part of nose, cartilaginous part of nose, incisions and other area. You can see in here when we enter the nose, we can rasp nose ridge bone and we can remove some cartilage tissue, the reason of nasal bump, and we can completely solve patients all these problems also too. Here is the same patients. You can see in here very white nose tip. This is bulbosity and some crooked nose and thick skin. With closed rhinoplasty surgery we can fix and solve all these problems also too. This is another patient with closed rhinoplasty surgery plus nostril reduction surgery. You can see 3 months after the surgery. You can compare with nostril size before and after changes, and couple of weeks and months later nostril reduction or alarplasty incision lines would be very unnoticeable also too. This is also front view, same patients, changes. This is not only white nose tip problems but also hanging columella and non-refinement nose tip and little bit crookedness before and after 3 months later results, 3/4 view and size view after the nostril reduction and alar base plasty surgery results. You can see here is nasofacial groove. We call about this here, anatomical name is this one. Before also there is different color and like a scar tissue, and after alar base plasty if needed, and this manipulations we can do this and we can achieve very close to our patients expectations results also too. Before alarplasty and after alarplasty incision lines also you can see here without any scar tissue. Closed rhinoplasty surgery. This is a male patient operated by closed rhinoplasty surgery. Same patient, 3/4 view, and this also other patients. But I operate these patients with open technique because of this is a 5 rhinoplasty surgery. I didn't do previously initial operations. You can see in here open technique incision lines, and I did same incision lines, incisions, and with open technique rhinoplasty surgery I try to do solve my patients these problems also too. This is open technique. I use open technique rhinoplasty surgery generally some revision rhinoplasty and some ethnic rhinoplasty patients, and my almost all primary rhinoplasty surgery patients, I use closed ultrasonic rhinoplasty techniques. This is also other patients, ethnic rhinoplasty. Also, I did this patient's surgery with closed rhinoplasty techniques. You can see in here without any incisions and scar tissue except alar-based plasty. You can see in here if you compare with previously before in this area, you can see there is very unnoticeable. Also in this region always little bit dark color and like a scar tissue and differently than other part of face. This patient's base view, you can see there is not any incisions, this closed rhinoplasty surgery and also alar-based plasty. And in here I wanna show you some illustrations what is alar-based plasty. We will do alar-based plasty if any patient's nostril size is too much big or alar wings is too much wide. Generally some ethnic rhinoplasty patients and some revision cases we need to do alar-based plasty or nostril reduction surgery also too, with some measurements at alar-based skin and inside of nostril skin. We remove some tissue in here, also in here too, and use some stitches in here. You can see this is the reason of more narrow alar flare and more narrow nostrils. This is also another patient's closed rhinoplasty. You can see with these techniques we can do everything like open technique also too. Patients has a bump and crooked nose, and we can solve patients all these problems without any skin incisions also too. Indeed, only unique differences of open and closed rhinoplasty surgery is this incisions. Except these incisions, I mean with closed rhinoplasty surgery, we can reach every part of patient's nose and we can do every maneuvers like open rhinoplasty techniques too, except there is not any columellar skin incisions also too. This patient's base view, you can see also alar-based plasty performed this patient's, removed some skin tissue in here. This is before, this is after alar-based and nostril reduction surgery results. This is also ethnic rhinoplasty patients. This is open technique rhinoplasty. I said before, I use open technique some ethnic and revision cases, and also I use at this patient's surgery open technique and also alar-based plasty. This is 5 days after the alar-based plasty results. This is also male patients. And with closed rhinoplasty surgery you can see there is too much problems, bump and hanging columella and unshaped nose tip and very wide alar flare and other problems. With closed rhinoplasty surgery we can fix and solve a lot of part of view these problems also too. Maybe this patient's little bit alar-based plasty would be a good idea, but my patients didn't want any alar-based plasty, and I plan my all operations depends on my patients' wishes and simulations also too. This is also revision rhinoplasty surgery. Previously she operated 4 times and 3 revisions and 1 initial surgery. But she has a alar collapse and very obviously nose tip. With closed rhinoplasty surgery we can fix these patients all these problems, these alar collapse problems and some symmetry problems, both alar wings also too. This is also revision closed rhinoplasty surgery examples also too. This is also revision rhinoplasty male patients before and after results. You can see there is not any incisions and scar tissue, but he was lucky. His previously surgery performed with closed techniques. Also, I complete his revisions with closed rhinoplasty techniques also too. As you can see, we can reach and we can do all maneuvers as open technique with this closed rhinoplasty surgery techniques also too. This is also base view without any scar tissue or incisions except alar base plasty incision lines. You can see he has a very big nostrils and white alar flare. With nostril reduction and alar base plasty, we can achieve more narrow alar flare and more narrow nostrils. Also more refinement nose tip because of previously he has a very wide nose tip. This is tip bulbosity also too. In this short video I will try to give you some informations about closed and open rhinoplasty surgeries. I use closed rhinoplasty mostly in my primary rhinoplasty operations. 90% of my primary rhinoplasty surgeries performed with closed technique rhinoplasty, and I use open techniques, some revision and ethnic rhinoplasty, and some other challenging primary rhinoplasty cases also too. At this point of view, I wanna give you my opinion about closed or open technique rhinoplasty surgeries also too. This is not important, closed or open technique. Most important one is your chosen surgeon, and this surgeon is more skillfully about these techniques. I know a lot of surgeons using only open technique, but he or she has very successful results, or vice versa. This is a different technique, and closed rhinoplasty surgeries advantages of without any scar tissue and incisions, and also maybe some below part of skin, some soft tissue, some preservation techniques. With these techniques we can achieve more natural results and a little bit more quickly healing time. Thanks for your attention.